Now we have a patient perspective. Tiffany Williams is going to speak about finding your voice and talking with your team. Your team. Don't forget that. All right, Tiffany, take it away.
Thank you, Kelly. So as mentioned, I am a myeloma patient as well, but I'm also a retired nurse practitioner with a 27-year career in healthcare. And in addition to talking about finding my voice as a patient, I really wanted to share with you a personal struggle that I had in finding my voice since being diagnosed with myeloma. Finding or using your voice as a patient is a learned skill for many of us. For some of us, it's natural, something that we really don't give a second thought to, and it looks different for everyone. And it's oftentimes based on past experiences and ideas of the doctor-patient relationship that we held long before even being diagnosed with myeloma. But nonetheless, finding and using your voice is very important, and it's an important part of your myeloma journey. And it's an essential component to changing the course of myeloma, as Dr. Mikkel talked about. And I refer or will refer to you often, but I'm also referring to us when I say that. So I might use those two interchangeably some. But what does it mean to find your voice or use your voice? And I think there are many definitions for this concept, but in the context of being a patient, I summarize it as having confidence, having freedom, and the courage to communicate with your care team. There's been an ongoing shift, a paradigm shift over the last 2 to 3 decades in healthcare as it relates to patient engagement. And you might be familiar with some of the terms or the frameworks used over the years and that are currently being used today to speak to this, such as patient advocate, self-advocate, patient-centered care, patient empowerment, and even shared decision-making. But what they all have in common is based on the premise that we should have a voice in our care and that healthcare is committed to welcoming our voice. But truth be told, there are challenges and barriers that can interfere with the ease of using your voice, particularly continuing with the theme that Dr. Mikkel introduced, that race matters in myeloma care and survival. And some of those things include, like, a patient might lack trust in the healthcare system, or the patient might lack trust or confidence in their own voice. Sometimes negative labels are placed on patients and caregivers who speak up. Mixed messages may occur when we're encouraged to engage in shared decision-making, but the provider doesn't embrace that concept. Conscious and unconscious bias or stereotypes may be present. Assumptions may be made based on where we live, how we speak, the type of insurance we have, or even how we look. Past and present experiences may also play a big role in the provider-patient interaction. Cultural differences are believed to be a major influence in the patient-provider experience for many ethnic minorities. And overall systemic obstacles, such as the amount of time a provider has to spend with the patient to address questions or concerns, for instance, might be an obstacle. And these are only a few, but understanding and being aware that challenges exist is the first step to overcoming such challenges. And as I shared, although I spent 25 years in healthcare as a registered nurse and nurse practitioner, I too struggled with using my voice. For me, it wasn't finding my voice that was the issue. You know, I was a patient advocate for others long before I was diagnosed with multiple myeloma. And I taught and still teach others to use their voice. But after being diagnosed, I noticed that I was struggling to use my voice with certain providers, but not with all. And I had to do a deep dive, a search for the root of my struggles. And I found that it was really a combination of things. But the primary reason was it was a learned behavior that I saw growing up. And I then resorted to those behaviors when the message that I received from a provider was one of superiority. I grew up in a community with my grandparents who couldn't use their voice when it came to the patient-provider relationship for reasons related to culture, related to the environment of the Deep South, as well as race relations. And it was an era when doctor superiority was the norm experienced by Blacks in the South. I was never told I couldn't speak up, but it was modeled, and it had a much greater impression on me than I ever knew. And it was something that, or something about those providers who made me feel inferior, that then tapped into those to those younger experiences that I saw growing up. So instead of using the tools that I built over my adult life, I reverted to the interactions that I learned as a child. But once I was able to name it, I was able to address it. Like Dr. Batani just said, when we know better, we do better. Many people of color in the South have negative experiences that impact their healthcare interactions. But there are too many great providers who welcome the patient voice. We should never settle for care that does not embrace our voice. Your care team is going to consist or does consist of a wide group of professionals, but the most important point here that I want to make is that you and your caregiver, or your care partner, as I refer to it, are at the center of the team. You are the consistent, the common denominator. It all revolves around you. Understanding the people who make up the team and their different roles is helpful in navigating the process and in understanding how they can help you. My team may look different than yours. The size of your institution or clinic may determine the size of your team. And if you're treated at a large myeloma clinic, your team may include many disciplines. However, if you're seen at a smaller clinic, it may not. So it is going to vary. But I'll point out here specifically, I guess to just focus a little bit more on the first string of players that I like to refer to it as. And I think it's fitting for this Empower workshop, being that the Carolina Panthers are my favorite football team. And even though I love football, I have a very basic understanding of it. So I'm going to try to use an analogy here to just point out some of those important key players. The multiple myeloma specialist is a must on that team. And that's the coach of the team. That's the coach of your care. And they are then calling the plays to your local hemonc, who's going to quarterback that play, and trying to get that ball into the end zone, trying to get you and your care into the end zone. And your PCP, we don't want to, once being diagnosed with multiple myeloma or any chronic illness, and we're seeing them on a routine basis, sometimes every 3 months, we tend not to see our PCP quite as much, but they are still a very important part of that team, because we need to be getting routine care and follow up with them as well. And then your caregivers, your family, your support team, they're your cheerleaders and the fans of your team to help, rally you and get you through. There are other subspecialists and allied health staff and others who are part of that team as well, but they come in at different times when they're needed, and they're not always primary in your care. We often refer to the myeloma specialist, but what is a myeloma specialist? A myeloma specialist is generally a provider who's a hematologist and oncologist who is specialized in multiple myeloma. They treat patients at hospitals that have a specific multiple myeloma treatment program or department. They participate in multiple myeloma clinical trials, and they publish in medical journals. They attend the big multiple myeloma meetings and seminars such as ASH, the American Society of Hematology, and ASCO, the American Society of Clinical Oncology, so that they can be informed on the latest updates and clinical trial findings and the standards of care. And most of them give presentations at these meetings as well. And another way to think of it is that numbers matter. The more multiple myeloma patients a provider treats, the better. It is, again, important that all multiple myeloma patients have a myeloma specialist, because patients who are treated by a myeloma specialist live longer. There are research studies that clearly demonstrate this outcome. The overall survival rates are higher for patients who are treated at high volume centers than smaller medical practices. Myeloma is a complex cancer and the therapies require specialized knowledge. And we heard that in Dr. McKell's talk earlier this morning. It's a highly individualized disease, and it requires a tailored treatment plan that specifically fits you. So while your day-to-day treatment can be monitored by your local doctor, your local hem-onc, it is important that, especially at the time of diagnosis and when treatments need to be changed, that a specialist is leading that treatment plan change. And having said that, though, it's not always easy or feasible for every patient with myeloma to be treated by a specialist. Access to a specialist might be difficult and in some cases not even an option for some patients. But it is possible to seek input from a specialist, even in situations when travel to a distant myeloma center isn't feasible. And in such situations, Dr. Dury points out that a phone consult may be an option, or to engage with experts to help guide care, attending meetings like this, regional community workshops, or the IMF patient and family seminars. And you've heard some in the question and answer session, how that's possible. You know, we've been able to submit questions and the experts have been answering and addressing those questions. So that's another way to engage experts. And also in the era of COVID, as we heard earlier, televisits are more common, and those present another option to connect with the specialist, particularly for patients who previously haven't been able to do so because of access constraints. Becoming an empowered patient is the goal. We have to understand our disease and participate in our care. Yes, the doctor and the team, they have the education, the knowledge, and even the experience to give us the very best care. But your voice matters, and it must be a part of the discussion. No one knows your body better than you do. And the IMF's mantra is that knowledge is power. So to become empowered, we must be equipped with the knowledge. We've got to tap into these opportunities to gain as much knowledge as we can. We can tap into the plethora of resources and tools that are available on the IMF website at myeloma.org. And Amy showed a slide earlier that showed many of those great resources. We have to take advantage of the seminars and workshops that are available to gain knowledge, as I mentioned earlier. You learn something new every time you attend one of these. And it doesn't matter where they are in the region. It doesn't matter who's presenting. There's always something new to learn, so we can attend as many of them as we can. And now that they are virtual, we have that ability to do that easier than before COVID when they were live. And attend a support group to become connected and empowered. Social media is another tool to engage with other patients and advocacy groups, as well as experts, to gain knowledge and support. But again, empowerment looks different for everyone. For some of us, it's a natural skill, like riding a bike. And for others, the idea of empowerment with respect to communicating with the team is not so natural or comfortable and can sometimes even feel overwhelming. But if you've never struggled with using your voice, especially in the patient doctor-provider relationship, this concept might be difficult for you to wrap your head around. But it is a reality for many people for many reasons. But you don't have to feel alone. Utilize your support system and support groups to help you. The myeloma community is the most welcoming and supportive group of people. Connect with someone who can support you. Taking small steps to reach a big goal is never a bad idea. And there's a quote by Desmond Tutu that I often use. There's only one way to eat an elephant, one bite at a time. The message is that everything in life that seems overwhelming and even impossible can be accomplished gradually by taking on just a little bit at a time. Communication is important, and it's also a two-way street. It's important that every member of your care team communicate well, and that includes you. Ask questions, and always remember, no question is a dumb question. Be open and honest about your symptoms and your concerns. Symptoms in isolation of one another might seem unconnected, but may very well be connected and easily managed if conveyed. There are multiple ways to communicate and convey your concerns, but determine what makes it easiest for you to engage in dialogue with your team. Have a caregiver or support person be your voice if necessary. Write down your questions and take them with you to your appointments. A journal can be helpful for communicating your symptoms and questions, but it can also be helpful just in terms of remembering things between appointments. Ask for time to consider options that are presented to you during your appointment, when possible, and ask for permission to record your visit. Finally, just find what works best for you. The most important thing to remember is that your team cannot help you if they don't know what your concerns and your questions are. And so I'll end with a quote by Chris Carr. She's a best-selling author, a wellness activist, and a cancer survivor. And she says, it's not always about finding your voice. It's giving yourself permission to use your voice. And I'll add to that, so that we can garner the confidence, the freedom, the courage to communicate with our healthcare team. And just a final few points to wrap things up and to leave you with. Every multiple myeloma patient should have a myeloma specialist. Patients who are treated by myeloma specialists live longer. Knowledge is power. You and your caregiver are at the center of your care, and your voice matters. And thank you all.